people who take steroids for a long period of time. That's important. The other condition some patients who are listening may know is a condition called ankylosing spondylitis, occurring invariably more in males than females. They have low back pain. The low back pain is worse in the night, worse in the morning with back stiffness, which becomes better as the day progresses. Left untreated, ankylosing spondylitis can result in a bamboo spine, and the person can absolutely become rigid, totally erect, not able to bend the spine either forward or backward, and is totally incapacitated. So any young person has back pain, more in the night, more early morning, with severe back stiffness, becoming better as the day progresses, immediately seek medical attention, because this disease can be controlled very well with biologics which are available now on the Indian market. Invariably, people think it is a disc problem and they even get operated. Just remember, nocturnal low back pain, which is disturbing you in the night, early morning low back pain with early morning low back stiffness, and improving better as the day progresses with exercise. Think of ankylosing spondylitis, ankylosing spondylitis, ankylosing spondylitis, and meet the doctor again. That's very important. This is another disease which is also seen in India, very commonly seen with the rheumatologists. Is a condition which is called systemic lupus, which will present with hair fall, which will present with prolonged fever. It presents like a typical butterfly rash over here. It presents with oral ulcers. Some people have blood pressure. Some people have fluid in the lungs or in the abdomen. And some people have even kidney involvement. So systemic lupus is a condition which is prevalent, very important. Prolonged fever, rash, oral ulcers, arthritis, blood pressure, kidney involvement. Think of this possibility and immediately seek medical attention, because this is the disease which needs to be diagnosed as early as possible and treated as early as possible. That's very, very important. If you start treating SLE later, it is like closing the stable after the horses have sped. That's very, very important. Early diagnosis, early treatment, and regular follow-up is absolutely essential. The last one is a condition called scleroderma. Derma means skin, sclero means hardening. You see, this particular women, we can't be able to pinch the eyelid, and the eyebrows and the facial skin, the cheeks. It will be very, very hard. It will be hidebound. So think of that condition and seek attention from the doctor. Coming to the end of my lecture, should arthritis patients avoid cold climate? I spent a very nice time in Europe about 4 to 5 years ago. That's because I went along with some of my patients. They said that they want to go to Europe. It's very cold. I said, I'll also, please take me, I'll also come. And the person was so nice, he took me to Europe also. What I'm telling you, you need not avoid cold climate. Arthritis is seen in Eskimos. It is seen in the coldest parts of the world. So cold climate will not cause arthritis. Only thing, if the weather is a little cold, the joint pain may increase. But the disease does not increase due to cold weather at all. You can keep yourself warm by wearing protective clothing, protective gloves, woolen gloves or cotton gloves even in India. Then you can have a heater in the room, have a hot water bath, mobilize your fingers and feet in warm water with a pinch of salt. So it doesn't mean that arthritis patients should not avoid completely cold climate. Just because somebody has got arthritis in Kathmandu or he's got it in Kashmir, it doesn't mean he has to come to Chennai, because it's very hot over here. Even in Chennai, you will have arthritis. Even in Kashmir, you will have arthritis. Yeah. How to cope with arthritis? This is a question which I think I have to answer very emotionally and sentimentally. Arthritis is a prolonged disease. Majority of them are not curable. Some of them are only controllable. Some of them only are curable. Majority are only controllable. It affects the activities of daily living. You become dependent on people. You lose your job. Financially, you're very weak. There is no social support. Before, you know what was life? It was an attached bedroom and a detached bathroom. Now it is a detached bedroom and an attached bathroom. The nuclear family has totally disintegrated the joint family system. No support at all. So you become dependent on others financially, socially, psychologically. People get depressed about it. So what the family has to do has to be absolutely supportive. Some people develop arthritis after marriage. Either the husband or the wife comes and tells me, no, she's not developed arthritis, or he developed arthritis. I can't take care of him. What would have happened if the other person had developed arthritis? You can't take a guarantee before marriage, I will not develop arthritis, I will not develop arthritis, I will not develop ischemic heart disease, I will not have hypertension, I will not have stroke. Anybody can develop arthritis in this world. We have to be empathetic. We have to be concerned. The greatest joy of living is in sharing your empathy with others. We as doctors have to do it, the physiotherapist has to do it, and the family also, very important. Poor people, they are not doing it purposely. So coping with arthritis is providing them adequate psychosocial, emotional support. That's very, very important. But every patient with arthritis, the message which I will tell you is, accept your problem. Don't be rebellious to the present. I know, it's very difficult to have joint pain and say, this Ramakrishnan is talking philosophy like the Buddha. But the reality which I actually learned in life was, accept situations. Don't be rebellious to it. Surrender. Take the treatment. Take the medications. Regular follow-up with the doctor. Adequate nutritious diet. Do your exercises. And be positive. If you are negative, people have found there is defective functioning of the immune defense system. It can precipitate arthritis, or it can worsen rheumatological diseases. It's very difficult, easier said than done, but nothing is impossible in the world, which is said by Napoleon. Napoleon said, the word impossible has to be removed in the dictionary. So remove such words, get into meditation, yoga, introspection. That will help you a lot. That's very, very important. So in the elderly, if you want to prevent falls, you'll have to have the bathroom brightly lit. You have appliances to get holdings to stand up. And the last few slides is be the Buddha. The present is a present. The future is a mystery. The past is history. We waste our future by thinking about it in the present. What will happen tomorrow to joint pain? What will happen to arthritis? I have taken a drug. Will it cause kidney problem? Will it cause depressed immune system? Throughout the time, we are anxious about something happening, which never happens at all. You know what is the biggest problem with COVID? People died more due to fear than COVID. When will I develop COVID? Will I get hospitalized? Will I get into the ICU? Not at all. Live like the Buddha in the present. Learn to live in the present. That's very, very, very important for all of us. The last one is, unfortunately, I have been blessed to write a blog called wisdomramti.com. I can tell you honestly, I am empty, absolutely an idiot. I'm not writing the blog. It is written only by the creator who's just dictating to me. I'm an ordinary typewriter. Once when I was returning home from the hospital at 12 o'clock after 3 people died, my ego was defeated very badly, and ego was absolutely deflated. At that time when I was coming, I just saw a graveyard at midnight. In fact, Thomas Gray wrote the eulogy of the graveyard. It's a very church. You have to read that. That's where it is written, all paths of glory but lead but to the grave. So I just looked at the ground, which is very brightly lit. The ground came to life and told me, this ground which forms the floor when you're alive will soon become your roof when you're dead. That is existence. So that day the graveyard told me, live the moment, Ramakrishnan. Even at midnight, live that moment. So what I feel is, arthritis, don't get worried. Drugs are available. Warning symptoms are pain in the joint, swelling in the joint with difficulty in moving the joint, incapacitation of the joint. Rheumatoid arthritis, more common in women than men, affects them at the peak of their life. Wonderful drugs are available to treat rheumatoid arthritis. Compliance with doctor follow-up, compliance with medication is very important. Well-balanced, nutritious diet is very important. A good rehabilitation program, and cope with arthritis, cope with the anxiety. And any young person with low back pain, worse in the night, worse in the morning, with low back stiffness, think of ankylosing spondylitis and seek attention from the doctor. Arthritis is not preventable. Majority may not be curable. It is only controllable. But long-term treatment, early treatment, people are fine. 37 years ago, I had the ego to say, hey, I have diagnosed rheumatoid arthritis, but I could offer only my sincere condolences to a patient and say, I don't have any drugs to treat you. Today, I have become humble because all those experiences taught me that you are only human, you are not God. You are only a doctor, you are not a healer. Now, with the advent of wonderful drugs like disease-modifying drugs, biologics, investigations like MRA, we are able to diagnose arthritis early and make the patient as normal as possible. I wish all of you a very happy Sunday. Extremely sorry to have troubled you on a Sunday by talking for 45 minutes.